Welcome, everyone, and thank you so much for joining us for today's opening plenary. I couldn't be more honored and excited to be here to kick off this year's Medicare for All Strategy Conference. My name is Alex Newell-Taylor, and I am a community organizer with National Nurses United, working on our Medicare for All campaign, and I'll be moderating today's plenary discussion. I want to start with a huge thank you to the team at Healthcare Now for creating this space for us all to come together and work towards the future that we all want, a future where every single person can get the healthcare they need and that they deserve, a future where healthcare is a human right. For too long, the profits of the corporate healthcare industry have been prioritized over the health of everyday people. And communities of color are bearing the burden of this inhumane and unjust system more than ever. It's clear that if we want to win Medicare for All, we need to center the voices of those communities who are most impacted by our broken system. So thank you also to Healthcare Now for making the discussion of racial equity the focus of this year's conference. Today's plenary will feature two incredible organizers from National Nurses United's Medicare for All campaign, María Lopez and María Torres-López. María and María will give us an inside look at how they have worked to center the voices of communities of color in this movement for healthcare justice, and how they've intentionally created spaces for communities of color to come together to learn about racial health inequities, how Medicare for All would be a big part of the solution to overcoming those inequities, and how people can get involved in the movement. I know you'll all really enjoy hearing from María and María about their work. But first, we are going to hear from someone who has been leading this work for decades, registered nurse and president of the New York State Nurses Association and National Nurses United, Nancy Hagans. We are so lucky to have Nancy joining us for today's plenary. If you haven't already heard the great news, the 42,000 members of New York State Nurses Association, also known as NYSNA, voted overwhelmingly to affiliate with NNU in October of last year. The two organizations are well aligned in their approaches to powerful representation on behalf of nurses and the profession, supporting efforts such as creating strong workplace standards to protect nurses from infectious diseases like COVID-19, establishing federal safe staffing laws, holding employers responsible for preventing workplace violence, and fighting for healthcare justice in our wider society. Both organizations also share a deep and long-standing commitment to the fight for universal guaranteed healthcare at the state level through the New York Health Act and nationally through Medicare for All. As the president of NYSNA, Nancy brings a wealth of experience and a powerful voice to the National Nurses United Council of Presidents, which she joined in December. Nancy was born in Haiti and moved with her family to Brooklyn in the 1970s. From an early age, she was drawn to activism on behalf of her community. At age 19, Nancy was one of the 50,000 people who marched across the Brooklyn Bridge to protest federal designations that unfairly stigmatized Haitians as being ineligible for blood donation due to a supposed increased risk of HIV infection. Just days after the massive protest, the FDA announced that it would abandon that policy. As a nurse at the Maimonides Medical Center, Nancy was elected to the executive committee, becoming the newest and youngest person on the committee when the nurses went on strike in 1998. Since then, Nancy has continued to fight every day for nurses and their patients. As a union leader, Nancy was instrumental to winning New York's law that imposes some regulations on staffing ratios. Nancy is also a strong supporter of Medicare for All. Having been at the epicenter of the COVID-19 pandemic in New York City, Nancy saw firsthand how our broken healthcare system exacerbated the crisis. She recognizes that we need Medicare for All so that all patients can get high-quality, comprehensive medical care, no matter their income, zip code, or immigration status. Nancy's voice has always been a powerful one in the movement for healthcare justice, and we're so fortunate to hear from her today. I'm honored now to hand it over to Nancy, who will kick off today's discussion of why racial justice and healthcare justice are so inextricably linked. Nancy, over to you.
Hello. Thank you to my esteemed colleague who have worked to put this dynamic conference together. My name is Nancy Hagans. I am the president of the New York State Nurses Association and National Nurses United. I am a critical care nurse, and I've been a registered nurse for the past 37 years. We are here at this Healthcare Now conference. Everybody's in. Racial equity and Medicare for all. Because we know this time's call for a change. Medicare for all is that change. As a nurse, I see clearly how widespread social, economic, and racial injustices come together to make patients sick and can lead to early and unnecessary death of my patients. 3 years into the pandemic, we continue to see firsthand how racism, social injustice, and economic inequality lead to uncontrolled infection rates and death. At the start of the pandemic, we saw how patients suffer from outrageously high rate of unemployment that left them without insufficient means to buy food or medication, or the appropriate level of insurance they need to seek medical care. We saw and continue to see economic inequality and environmental racism, coupled with racial discrimination, leaving Black, Brown, and Indigenous people more vulnerable to exposure, complication, and death caused by COVID-19. We have seen how the devaluation of essential service work put workers of color on the front line of the pandemic at higher risk, where they are forced to work without adequate personal protective equipment or health insurance. We see how for-profit healthcare system is set up so that patients with the highest health needs are the least likely to get care. This is a brutal reality that continues to shape the lives of our families, our workplaces, and our communities. Medicare for All is the only truly single-payer universal healthcare system. It guarantees healthcare, is a human right, and enables every person living in the United States to receive the healthcare they need. Universal healthcare is necessary for racial justice because communities of color suffer disproportionately from lack of access to affordable healthcare insurance. Over 30 million people in the United States lack insurance, and tens of millions of households have healthcare insurance but cannot afford to receive the medical care they need. Over 30 million uninsured people in this country, over half are Black, Indigenous, or people of color, or BIPOC. People of color make up 42% of the non-elderly US population, yet account for over half of the total non-elderly uninsured population. Black, Latins, and Indigenous people have significantly higher uninsured rates compared to white people. One reason for this disparity is that BIPOC people are less likely to receive job-based health insurance, causing these communities to be more at risk of being uninsured or underinsured. Healthcare debt, a rising issue affecting over 100 million Americans in 2022, disproportionately burden Black communities due to deeply embedded wealth disparities. In late 2022, it was found that 56% of Black adults have unpaid medical and dental bills, a challenge faced by only 37% of white adults surveyed. The disparity is among the lasting impact of generations of racial discrimination, depriving Black Americans of equal access to housing, employment, and other avenues to build generational wealth, according to the study. The legacy of segregation and structural racism underlies the racial health gap, impact health outcome and access, and it impacts the level of medical debt. Structural racism continues to impact healthcare throughout this country. Medicaid is a lifeline for many people of color and low-income patients. It's not accepted at many hospitals and doctors' offices. Black and low-income women are more likely than others to be treated at under-resourced hospitals, increasing the chance that may experience complications during and after childbirth. Hospitals' quality can account for nearly 50% of the racial disparity in maternal illness. With Medicare for All, there are no out-of-network provider limits. Patients can get care they need when it is appropriate and convenient for them. Communities of color need a healthcare system that rectifies long-standing structural biases and challenges. Medicare for All is that system. Healthcare justice has always been central in movements for racial justice. We can remember that it was through the tireless work of the civil rights activities and organizations like the NAACP and the National Medical Association, a profession organization of Black doctors created due to exclusion from the American Medical Association, that hundreds of hospitals were desegregated with the enactment of Medicare in 1966. Our fight for Medicare for All today must build on the legacy of the civil rights and other movements by finally making healthcare a guaranteed right for everyone and overcoming the racial injustice that remain deeply entrenched in the for-profit U.S. healthcare system. Our fight for Medicare for All is about guaranteeing all people a right to health. It is about investing in the care and well-being of our communities. It is intimately tied to the movement for housing, education, safe jobs with fair wages, and environmental justice, all of which improve public health and promote justice. We know that when we have the power to make change, and that when standing together across a movement, we can win. We are very proud of the fact that this movement is led by nurses. Nurses are on the front line of the broken healthcare system and know better than anyone what needs to be done to fix it. But we also know that we don't do anything alone. Our National Medicare for All campaign draws its strength from being a grassroots movement of committed people. We thank you, and we look forward to continuing to work together, hand in hand, toward true healthcare justice. Thank you.
Thank you so much for those powerful words, Nancy, reminding us of why the focus of this year's strategy conference couldn't be more timely or more urgent. Thank you, Nancy, and all of the nurses at National Nurses United for your leadership on this issue. So I am thrilled now to introduce our panelists for today's discussion, María Lopez and Maria Torres-López, both organizers on National Nurses United's campaign to win Medicare for All. María and Maria have shown incredible leadership in creating spaces for people of color to come together to learn about Medicare for All and how it could have a positive impact on their communities. Together, they spearheaded the creation of the Medicare Para Todos program, which aimed to engage monolingual Spanish speakers in the fight to win Medicare for All. I also want to take a moment to acknowledge that for too long, the Medicare for All movement space has been dominated, like so many other spaces, by white culture. But I'm sure everyone agrees that if we are truly to win, we must center the voices of those most impacted by our broken healthcare system. This conference is a great start to that process. And I know my fellow white activists will learn so much from hearing from María and Maria, and of course, we already heard from Nancy, and hearing the rest of this year's conference. I hope you will join me in renewing your commitment to listening, learning, and following the lead of our BIPOC sisters, brothers, and siblings in the fight for healthcare justice. And now, without further ado, let me welcome María and Maria. Thank you so much both for being here. I'd love for you to introduce yourselves before we dive into this engaging conversation. María, would you like to go first?
Yes, thank you. Thank you so very much, Alex, and thank you for having me here. I really appreciate the opportunity to talk to you all about the programs that we have engaged in here at National Nurses United, California Nurses Association, in supporting and engaging communities of color.
Thank you so much, María. And Maria?
Thank you so much for that introduction. Very excited to be here. I can't wait to share all the information we have with everyone.
Thank you. Thank you both. All right, well, let's go ahead and dive into this discussion. So to start us off, can each of you just tell us a little bit more about the important work that you've been doing to engage communities of color to get involved in the fight to win Medicare for All? María, would you like to tell us a little bit first?
Sure. So the National Nurses United, California Nurses Association's Medicare and CalCare campaigns, respectively, believe that communities of color should be central to the campaign and movement for guaranteed health care. So much so that our members of the MFA team that you are also part of, Alex, developed the Strategic Outreach and Outreach Committee, also known as SOC. And through this program, we developed materials and a strategy for reaching communities of color so that our Medicare for All Black, Indigenous people of color, popularly known as the BIPOC program, Medicare Para Todos, and also MFA for LGBTQI were created under SOC so that we can reach communities of color to engage them, diversify our movement, and really ensure that everyone is part of this movement and has a stake in changing our healthcare system.
Thank you, María. And Maria, would you like to tell us a little bit more specifically about the Medicare Para Todos program?
Yes, I can expand on what María mentioned. So we started all of those programs because the fight for guaranteed healthcare for all at the federal level has been missing more voices of color, with the belief that those closest to the pain are closest to the solution, and with the understanding that many Black and Brown people have a lower socioeconomic status. It is normal to say that we believe that people of color need to be centered on this fight. That was the goal of the BIPOC program and the Medicare Para Todos program, which we also call MPT. People of color need a space where they're centered, where their needs are met from the beginning and not as an afterthought. And the reality is that most groups that are not BIPOC centered fail to meet BIPOC needs and a sense of safety. The groups and community members needed and wanted the information we were providing in their language on the Medicare Para Todos program. They wanted to have a space to come together and strategize and problem solve. The reflections and learning lessons for me as to the Medicare Para Todos program is that we can no longer be an afterthought. BIPOC communities are needed to win this fight for universal health care. They know that what the problem is, and they don't need groups to go into their communities with a top-down hierarchy mentality to teach them about the problem. What they need is the resources and encouragement to self-organize and value their ideas on the best problem-solving strategy for their community. On the Medicare para Todos, aside from having the second most spoken language in the US as the Latinx community, we are often characterized by a tightly knit family structure in which multiple generations live under a single household. These mean multiple members and generations of uninsured family members under one roof, but it also means that our possibilities for organizing are exponentially maximized. Medicare for All fundamentally will transform our healthcare system for everyone, and it has the potential to do so most significantly for people of color. As the majority minority population, the Latinx community is poised to be a significant force within the Medicare for All movement. To win, our campaign must be multi-generational and multilingual, beginning with Spanish as the second most spoken language in the country. And that's why we believe on the Medicare para Todos program.
Thank you both. I know having witnessed a little bit about this work that you all have done, it's just so exciting to see, you know, the potential of what you're creating here. So thank you both for that really important work. So moving on to the next question here, how do both of you feel that privatized healthcare exacerbates racial inequity? Maria, do you want to kick us off on that one?
Yes, I definitely can. Thank you for that question. Very important. So I want to take us back a little bit. Racial disparities are part of the fabric and making of the United States. I don't want to for us to forget that. As such, most privatized institutions carry some racial inequality as part of their unwritten ethos. When it comes to healthcare and racial inequality, we need to talk about financial equity and equal pay. The same way that women make a portion of what white men make for the same job, women of color and men of color also earn less than white women and white men. That's the first discrepancy based on race. This puts people of color at a disadvantage when looking for quality healthcare. Additionally, we know that many of our health institutions are for-profit, rendering them not accessible to low-income folks. I actually have a personal story that I would like to share with everyone today. Over a decade ago, I had a cancer scare with no health insurance. My doctor needed me to have a biopsy done, but with limited financial resources and as a working mom, I had to shop around different hospitals and biopsy facilities to see which one was the most convenient and affordable for me and my family. This research was very eye-opening to the reality of how badly managed our healthcare system is. The prices range from $1,000 to $35,000. Not only is that a staggering difference, but it also shows how private institutions overcharge and sell higher than needed standards for some procedures. For example, as a surgical technician, which I was, I knew the biopsy I require could be done in a semi-sterile or outpatient setting. However, two of the most expensive estimates came from prominent hospitals in South Florida, both of which require patients to be put under general anesthesia and use an operating room for what otherwise is an outpatient procedure. As I stated previously, Medicare for All will fundamentally transform our healthcare system for everyone. And it has the potential to do so most significantly for people of color. And that could be me. That could have been me. Had I been able to use Medicare for All during those trying times and stressful times, my biopsy would have been done at a much faster time and with much less stress to me and my family.
Wow. Thank you for sharing that story, Maria. Unfortunately, just way too common a story, right, in this country. So Maria, Mari, anything to add there about how privatized healthcare exacerbates racial inequity?
Yes, thank you. Thank you, Maria, for sharing that very personal story as well. Yeah, I agree with what Maria is saying. And to add to that, in the past 50 years, the U.S. healthcare industry has drastically changed from focusing on patient outcomes to being profit-driven. And this really influenced the availability and delivery of healthcare in communities of color. The healthcare decisions, like the geographic location of a hospital, the services that will be offered, and the extent of care that will be provided, are based on profit. And so, low-income communities that have historically been populated by people of color who also have low rates of health insurance among individuals and families are going to be left without facilities, because these areas will be considered by hospital systems to be unprofitable. And so community hospitals that serve low-income people of color communities are at risk right now of closing down as we speak, as a result of taking on more patients. And hospitals, they're taking on more patients who are becoming more and more uninsured as well, or underinsured, a term that we know to mean that people who have insurance but can't afford to use it because of additional costs such as copays and deductibles. And so as these hospital systems move out of communities of color, again, because they're not making a profit, these communities of color, low-income communities, are going to be left without facilities. And this is going to further exacerbate health outcomes for people of color. And we haven't seen these costs coming down anytime soon. So this is just the beginning of how inequities, or just one of the reasons why health inequities in our healthcare system continue to exist.
Yeah, such important points, Mari. Thank you. So we've talked so far up to this point a little bit about the problems that we see from the privatized healthcare industry. Shifting a little bit now to talking about how healthcare justice can be linked to racial justice. So how are the two things, how can the fight for healthcare justice lead us positively to a fight for racial justice, both historically and in our current times? Maria, do you want to kick us off on this one?
Thank you so much for that question, Alex. I'm going to try to put it all together for everyone, because sometimes it's really hard to connect those two things. So a few people know the connection between the passage of Medicare and the 1960 civil rights movement, particularly the role of Medicare played in desegregating the country's hospital system. In line with the attitude and practices towards people of color at that time, the healthcare industry was built on discriminatory and racist policies that people of different races should have received other type of healthcare, including sometimes none at all. Unfortunately, some of this still permeates the industry today and affects how people of color receive or don't receive care. The National Medical Association, founded in 1895, is a professional organization of Black doctors and was a catalyst in organizing Medicare as a tool for the desegregation of hospitals. Before the Civil Rights Act of 1964, hospitals and medical schools were highly segregated. Jim Crow was widely practiced, and most medical institutions were white only. Racism was practiced in the North by turning away Blacks and other people of color from hospitals in white communities and hospitals treating white patients only. For those of you who like music history, check out the story of when Frank Sinatra wanted to know why his great friend and colleague had not gone to see him at the hospital, to which Sammy Davis Jr. had to reply, "Frank, I did. They wouldn't let me in." And this was only to go visit a beloved, famous friend. Can you imagine what it would take to get any type of healthcare in those hospitals back then? As part of the Title VI of the Civil Rights Act, Medicare decree unlawful to discriminate against people of color in hospital settings. Hospitals that continued the practice of segregating wards and other segregation within the hospital based on race became ineligible for federal funding. The potential loss of hundreds of millions of dollars forced changes in hospital policy around race almost overnight. Much like the passage of Medicare in the 1960s made insignificant impact on the civil rights movement, we firmly believe that passing Medicare for All will be a step towards dismantling these outdated racist ideologies, protocols, and practices that we still see today. We believe that Medicare for All help us get there because it removes the barriers that communities of colors face, such as low representation in employer-provided health insurance job, inability to afford directly bought health insurance because of the overrepresentation in low-wage jobs, living in medically underserved areas that exist mainly in communities of color, creating healthcare deserts. One new addition to current Medicare for All legislation is the creation of an Office of Health Equity. This office will formalize data collection regarding racial health disparities that will help us better understand where disparities are more acute. The bill compels Medicare to collect data, develop a plan to address the inequities, and implement a plan after the first year to begin addressing issues involving these disparities.
Thank you, Maria. Thank you for sharing that history. I'm sure there's lots of people watching who probably didn't know about some of that history. Mari, do you want to add anything to that?
Yeah, thank you, Alex, and thank you, Maria. Yeah, Maria's right. The country's had a long history of racial biases baked in all parts of our society. And that, of course, includes healthcare. Under Jim Crow that Maria mentioned, the concept of a separate but equal, or in this case, unequal, was applied to healthcare and contributed to many of the racial health disparities that still exist today. But we've also seen how addressing and challenging those biases through our healthcare system can help break down biases in other parts of society as well, such as in education and housing. One example of that fight for healthcare justice has been linked to the fight for racial justice historically is what we see in the documentary Power to Heal, which tells the story of how some southern states were engaging in segregation in hospitals. Again, as Maria has mentioned, people of color were placed in these catch-all units where whether you're pregnant or you had a heart attack, wherever, you were placed in the same unit as all of the patients of color. And of course, this was not just the case for white patients. This was who could receive more specialized care. This segregation led to the exacerbation of health inequities along racial lines. But when then President Johnson signed Medicare into law in 1965, it required hospitals that practice segregation, prohibited them from qualifying for federal funding under Medicare. So we saw hospitals change policy, and the dismantling of discriminatory practices in our healthcare system began. So we can see that the fight for healthcare justice can absolutely have an impact on the broader fight for racial justice. And bringing it to today, in 2021, during the pandemic, Dr. Anthony Fauci admitted the existence of discrimination in our healthcare system, and that was which was undeniable during the pandemic. And so admitting to that you have a problem is the first step to the healing.
Absolutely. I love that, Mari. So I wanted to bring us back to something that I think Maria said way in the beginning of our conversation that I just loved about how the people closest to the pain are also closest to the solution. And I really love that framing. I think it's such a good reminder. And I wanted to know if you each would mind sharing some powerful moments that you've experienced working across communities in this work to find that solution by building a movement for Medicare for All. Madi, do you want to take that one first?
Yeah, sure. Thank you, Alex. Yeah, again, it was during the most memorable experiences for me came out of the creation of our strategic organizing committee, where we specifically reached out to communities of color, like when we presented Medicare para Todos for the first time. For me, I presented that program to a monolingual Spanish-speaking audience, and it was really moving and touching as they were hearing the information. They couldn't believe the fact that we were building a movement to transform our healthcare system that saw them as a critical component to that movement. And so often when we began our campaign presentations to people of color and audiences, they would say Medicare for All and it is great, but they would assume that they're not included. That they didn't have the right job, or maybe they didn't have the right income or the right social status, and so this transformation of healthcare wouldn't include them. So to see a person's attitude to go from feeling like an outsider that was hearing this information to being part of this change was really, really inspiring. And even Caucasian people were excited for the BIPOC and Medicare para Todos programs is when we presented BIPOC information, because people of color would now believe them when they shared that people of color were truly central to the movement. And so the number of people of color and people who speak languages other than English has really changed and diversified our movement. And it's not only grown exponentially within the movement of Medicare for All and CalCare, but these individuals have also developed into leaders. And this is because NNU CNA has prioritized people of color and made them central to the movement for guaranteed healthcare, which is bigger and more diverse today than it has ever been in its history.
Absolutely, Mari. It's really exciting work. Maria, you want to add anything?
Yes, I can add something real quick. The most powerful moment for me is usually when organizers realize how people already know what they need and deserve. There are so many instances, I feel, in which we go into communities thinking that we will unveil this big us behind the curtain, when in reality, we're only there to be a vessel for the knowledge they have, the same knowledge that will create the solutions that are needed in that community. Even when they might not fully understand Medicare for All as a bill, they know what they need and that they need something different, a system that doesn't deprive them of physical and mental health. Additionally, I think on the Medicare para Todos specifically, the fact that we escalated our campaign to include texting to California Spanish-speaking populations to share Medicare para Todos program, that was really, really rewarding. That gave us, we identified almost 10,000 new monolingual Spanish speaker supporters of Medicare for All by just giving them the information in their language. Also, our MPT texting program was so popular that we were able to build a team of Spanish-speaking texters, which continues to grow. These texters were able to handle the majority of our outreach in Spanish and develop their skills to where they were able to manage the campaigns themselves.
Absolutely. Love seeing that Spanish language texting team grow. It's been really exciting. All right. So we have one last question to talk about today. And that is the idea that we know, right? We all know that Medicare for All is an important social justice issue. But we also know that winning Medicare for All is not going to solve all of our problems. But I want to know how each of you think that winning Medicare for All would contribute to a broader advance towards racial justice. Maria, you want to take this one first?
Yes, I can. Thank you. Yes, I think we sprinkled some of these answers during the panel, but I'm just going to try to highlight a few more and perhaps make them a little bit broader. So when we talk about guaranteeing healthcare via Medicare for All, we also talk about women's reproductive health. This is a major win for communities of color and women of color. It is well known now that in this country, Native, Black, and Hispanic women's reproductive systems has been used to create more enslaved people or had been unilaterally taken away from them with undisclosed sterilizations. This bill helps ensure that neither options are ever part of our reality. Again, we're also talking about prenatal care, one of the many issues women of color face due to lack of access in areas where healthcare deserts are a reality. A key way Medicare for All helps address racial disparities in healthcare is by creating the special projects budget for hospital construction, renovating, boosting staffing and resources in rural, underserved, and medical shortage areas. This is especially critical since people of color are more likely to live in medically underserved areas, as I previously said. Medicare for All will provide additional health professional education and training to increase care delivery for underserved populations and in underserved areas. Increasing the number of nurses and healthcare workers from our communities who are culturally and linguistically competent is essential to caring for people of color and immigrant communities. Medicare for All specifically bars discrimination, including the reduction of medical services from any medical program, which could lead to discrimination and disparities in the care provided.
Absolutely, Maria. Mari, anything you'd like to add? Final words?
Yeah, thank you. Thank you for that, Maria, as well. Yeah, winning Medicare for All guaranteed that would be guaranteed healthcare for everyone would create a huge wave of change in how our society deals with race, how we treat the differences in one another, whatever those differences may be. right off the bat, MFA would develop an even playing field because healthcare would no longer be tethered to systems that have historically kept people of color from healthcare, like income, for example, that Maria had brought up earlier. The changes in our society would be enormous, starting with providing people the care that they need to get, to get and stay healthy. For example, our healthcare system could also could develop a medical model that is truly patient-centered care and is measured by a population's well-being and not an institution's economic performance. With a focus on patient care, we could also focus on investing in building healthcare facilities, as Maria just mentioned, where there are none. Or more are needed, just as in the case with overwhelmingly, particularly in communities of color. And this is just the beginning of how we could advance towards a more racially just society by inclusion and through dismantling the systems that already exist that serve to separate us.
Absolutely. Thank you, Mari. And thank you, Maria. Thank you both for that really engaging and really inspiring conversation. And also, I want to just once again thank you both for all of your incredible work and tireless commitment to advancing the fight for racial justice and for Medicare for All. I know I'm feeling so hopeful after hearing about your work, and I know that everyone else listening right now is as well. Well, that brings us to the end of this exciting conversation. If you would like to learn more about the Nurses Campaign to Win Medicare for All, I encourage you to visit our website, www.medicareforall.org. That's with the number 4, and then click the banner where it says join. We are hard at work every day to advance the fight for Medicare for All, and we have lots of ways for you to get involved. We will put you right to work. So again, that website is Medicare For All with the number 4.org, and then click join at the banner on the top. So I know we have an incredible week of workshops ahead of us, and I hope everyone joining and everyone watching learns a lot over the course of the conference. I know I speak on behalf of everyone involved in today's discussion when I say thank you again to the team at Healthcare Now for holding this space. I look forward to seeing you at the rest of the workshops. Have a great night, everyone, and solidarity forever.